Good afternoon, everybody. Welcome to the Parkinson's PD Teleconnection, a telehealth education program based here out of Spokane at St. Luke's. As always, thank you very much to St. Luke's and in the Northwest Telehealth for helping us get this program going. Just as a reminder, we'll hold your questions until the very end. Our presentation is about a half an hour, a little bit longer today, and then we'll go to each one of our locations and have you unmute your mic at that time and go over question and answers. But welcome everybody. It's nice to see all of the sites logged in. Hello, and all of the people who are here in Spokane who are joining us. This is always an interesting month in November because Veterans Day falls during this week, and we're very thankful for all of our veterans, but you never know quite what the schedule is going to be. So again, we really appreciate you. November is also caregiver awareness and support month, and so we're very thankful for all of our caregivers, whether they're our paid caregivers, our family caregivers, our friends. You all have a role in caregiving, and so we're very thankful for you. So thank you for what you do. Our title is changed a little bit, and I imagine you might talk about that just a little bit, but it still means the same thing. So vital to life, proper blood flow, and our talk today is BEMER, the proper supply of oxygen and nutrients to the cells and disposal of waste products equals a healthy body. And our presenters today are Gay Edwards and Max Kazin. Yay, I did it right. And I'm really looking forward to have this. They have a location right by the Parkinson's Resource Center currently, and we've been hearing a lot about them over the last year, so we're really excited to have them present today, and I'm going to turn it over to Gay.
Thank you, Cindy. Can you hear me all right back there?
Oh, you got a little bit of a echo. You have something going on. Try again.
How are we doing now? Distorted? Am I distorted? She's hot and I'm distorted.
You're dead. She's hot.
It sounds bad on the other side. I'll give you a hand.
Okay. Well, thank you, Cindy, for that nice introduction, and thank you all for attending today. This means a lot to me to be able to share this information with you because I'm so impressed about the information that I'm here.
I'm sorry, we can't hear it all. It's very fuzzy.
Hello?
It's late. I just told him.
Okay, we're going to change something here. Let me take this off.
Yep, take that. This is what you call Plan B.
Plan B is good.
Plan B.
As long as there is a plan B. That's all I care about. Is this better now? Everybody, okay.
Yes, thank you. It's better.
Yes, it's very good.
Okay, thank you. Well, I did get to know Cindy and became a frequent visitor of the Parkinson's Center about a year ago when I moved into an office in the bank building also on 6th and Washington and opened a center called Embrace a Healthier Way. Some of you may have been by that door and that sign, and we're real happy to be there. We have several associates here today, and I'm going to introduce them to you, and then you're going to be able to also talk with them about their experiences with BEMER after the event. So I'd like my associates to stand up, please, and face this way. Okay, this lovely lady here, she's hot too. This is Colette Bryden. She's an associate that works there with me at Embrace a Healthier Way. And here we have Dave Raymer, and he's also been with us for what, a year and a half?
About a year and a half.
About a year and a half. And then Max Kazin, who's going to stick with me up here because she's my techie person, and that's hot for me. You know, Dave, you're hot too. Excuse me, I didn't say that. Yeah. I said, you're hot too. Yeah, so it's okay. We're all that good. Okay, so thank you very much, and you will be talking to everybody later.
And we are all pleased that so many of you turned out to hear what we hope you will find not only informational but very helpful. So thank you for your time.
Thank you, Max. So I'd like to start with giving you a little background information on BEMER and also on my own personal story. This is an amazing medical device, BEMER technology. I'll start by saying that BEMER enhances the general blood flow and, I've lost my train of thought here, throughout the whole body from head to toe. And you'll see examples of that a little bit later. This improves functional circulation throughout the body. By enhancing blood flow, then, the BEMER supports the body's nutrient and oxygen supply, as well as the waste disposal or removal for the trillions of cells that the human body has. In 1994, I was diagnosed with Crohn's disease. You may know that's a horrendous and very debilitating intestinal disorder. I took massive doses of steroids that did help my pain and stop the bleeding. However, it left me with legs that jumped all over the place and feet that felt numb and painful. It took years, actually, before my immune system began to come back. It came back a ways, let me say. In 2006, I was diagnosed with breast cancer. I underwent bilateral mastectomies, chemo, and radiation. This period of my life was even more difficult than my years with Crohn's disease. So by the summer of 2013, my immune system was still very compromised. My energy level was flat, and I could no longer get a good night's sleep. But something really special happened to me in 2003. I was invited to a BEMER presentation much like this one by a dear friend who understood how much I was suffering still from those two horrific diseases. And I was very impressed that very first night that I heard about BEMER with the science behind BEMER, which you will hear some of today, and the German design, technology, and Swiss craftsmanship of this BEMER. And I did invest in a BEMER Pro very soon after that. And I have been rewarded for that decision and that investment every day of my life since that time. So now I'm going to read you the list. This is just a partial list, but it's an important list to me of what I've been able to enjoy as a result of BEMERing for a little over 2 years. After so many surgeries, those heavy medications, and lots of side effects, I had incredible stress. I felt incredible stress in my life. My body was left very sluggish. My brain was very foggy. And to tell you the truth, the worst of it all was that I was scared to death that the next shoe would drop. I felt that it was only a matter of time before I had the next disorder from having a poorly functioning immune system. Well, things have changed for me and my dear sweet body in the last 2 years. The first thing I noticed after starting to use the BEMER, of course I have it at home, so I use it twice a day, one in the morning and one in the evening. I noticed that my hearing improved. My hearing improved to the point that I no longer wear hearing aids. I was real excited about that. The next thing that happened is I was able to cancel an upcoming cataract surgery because my vision had improved and the brightness had come back to my eyes. My brain started working well so that I could remember names and places and people and my appointments again. My energy now, and still is, pretty much off the charts. And I started sleeping like a baby once again. And the good news is no stiffness, no aches and pains in the morning. That's pretty typical of what I feel every day upon awakening. Crohn's disease, well, the constant bloating and discomfort that I had in my stomach for many, many, many years was not an issue anymore, and it still isn't. At night, I no longer suffer with legs that can't relax, that can't stay still. My feet don't keep me awake by those awful stabbing pains and the nerves firing incorrectly. So with all of these improvements to my general state of well-being, you might be really impressed with this BEMER technology and thinking that BEMER must heal just about everything. And yet I wish to make something very, very clear to you right now at the beginning of this presentation. The BEMER does not heal anything. It doesn't heal any disease. It doesn't heal any symptom. Let me tell you what heals. It's my own body. My body now has the support that it needs, the nutrients it needs, the oxygen, and most importantly to me, all of that waste disposal from all of the chemicals, the surgeries, the scar tissue. All of that is being removed from my body every day when I lie on the BEMER. My own body has taken a turn for the better, and that's why I feel good today. So with that, I really would like you to see a presentation by our USA medical consultant, Dr. Joshua Burka, who works not only with me and with the IBDs, the independent BEMER distributors that I brought with me today, but also with anyone who owns a BEMER. They are allowed, they are welcome to call him at any time to discuss how they're feeling and what they might do to feel better. So here we go.
Hello everyone and welcome to today's webinar on BEMER technology. My name is Dr. Joshua Burka, Medical Expert Center here at BEMER USA. In today's webinar, we're going to be reviewing the fundamentals of the BEMER signal, applications and usage guidelines, as well as some frequently asked questions. With that being said, I would like to start with this disclaimer here. BEMER products are in no way a substitute for professional medical care. There's no medical claims being made from the use of these products. Statements have not been evaluated by the FDA or government agencies and are not intended to...
I shut it down.
Let me see if there's something I can do.
We're working on the sound.
Did you have it? Yeah. Show that. Oh, it's 100%.
Maxed out.
Yep.
And this is maxed out too.
Yeah, that's 100%. Yeah.
diagnose, treat, and or cure any medical conditions or diseases. You should always consult your own physician and or primary healthcare provider if you have any medical concerns. BEMER products are wellness and fitness systems, and all information presented in this webinar today is for educational purposes only.
Okay.
Excellent. So what is BEMER intended to be used for? BEMER therapy is intended to be used to enhance the general blood flow. And by enhancing the blood flow, you support the body's nutrient and oxygen supply as well as waste removal. This enhances cardiac function, physical fitness, endurance, strength, and energy. BEMER is also excellent for prophylaxis or prevention. As you increase blood supply to various tissues, especially the brain, you can support and enhance concentration, mental acuity, reducing the effects of stress, and further supporting relaxation. BEMER also has a sleep program which helps with the circadian rhythms, the natural circadian rhythms, for those individuals who wish to have help managing sleep. So our body works most effectively when we have the nutrients, when we have the oxygen delivered to the cells, and the waste products, these metabolic waste products, are properly removed. And this all occurs due to a healthy cardiovascular system. And of course, a functional circulation. When this process becomes disrupted, disease or dysfunction manifests or occurs. BEMER is the most researched PEMF system on the international market, and so many people want to know or understand, how is it that this works? Why is this the case? And it all starts right here. The fundamentals of BEMER's effect comes from the unique waveform or signal that it uses. The BEMER signal was created back in 1998, and as you can see here, this is the mathematical formula that gives rise to this unique multidimensional complex sinusoidal waveform. Its effects, though, on the left side you can see an example of different waveforms which have been utilized in the past by traditional PEMF devices. You have the sinusoidal, trapezoid, triangular, sawtooth, and double sawtooth waves, but their pulses only reach a certain segment of cell frequencies. Notice on the right here the broad range of the BEMER's waveform, and this unique waveform has 5 international patents and reaches millions of cells within the body. When comparing these various forms, you can see even the most complex wave on the left side has maybe 300 stimulations per second versus BEMER's 1200 stimulations per second. That means more signal to more cells, more effect. In addition to the signal and waveform, the BEMER has a unique electromagnetic field distribution, which enables the BEMER to affect multiple cellular processes simultaneously. While BEMER does exhibit multiple effects, the BEMER's PEMF, the electromagnetic field, has a profound effect on the the body's systemic circulation, or what we call hemodynamics, blood movement. And how exactly is this happening? The waveform or the signal is one aspect, but the manner in which this is delivered through timely variation is also very important. And the frequencies that BEMER deploys to positively affect the blood flow through the body are 10 and 30 hertz. The 10 hertz ultimately affects the larger caliber arterioles via direct nerval effect, and the 30 hertz affects the smaller caliber arterioles through the stimulation or production of nitric oxide, or NO, which, as we know, is a vasodilator. Therefore, the BEMER displays its effect through a neuroendocrine mechanism of action. The BEMER comes in a couple different models here. These two models are the professional, as you can see in the front, and the classic models. These are the brains of the BEMER, the BEMER box, or also known as the B box. And the first and most obvious distinction between the B box Classic and the professional is the touchscreen interface on the Pro system versus that of the Classic, which has raised interface buttons that you can physically touch. On each system, you have levels 1 through 10. You have programs 1, 2, 3, as well as sleep programs. For instance, on the Classic, S1, S2, S3, that can be set for 6, 7, or 8 hours for the sleep program, respectively here. And for the Pro, you have programmable timing that you can utilize for the sleep program. A lot of people always ask as well, what is the frequencies that BEMER uses with the AC current? Well, BEMER is plugged into the wall. When it's plugged in, it uses an AC current, and that AC current or alternating current is converted to a DC current, and then that is used to drive the BEMER signal with the 10 and 30 hertz as we discussed. As we know, as I discussed before, the BEMER patented waveform uses a complex sinusoidal proprietary combination of 10 and 30 hertz to stimulate optimal blood flow and positively affect systemic circulation. The BEMER Pro comes with a B body, the B grip, the B spot, the B light, and the B pad. The BEMER Pro is by far the most diverse BEMER system available on the market. It can control and run any combinations of 2 body mats, applicators, whether they're different or the same, and or applications of 2B bodies simultaneously operated. And you can do this together or controlled independently of each other using either a selected level or a program. And it's these unique features which is why many home users and practitioners, they make the choice to buy the professional and utilize it either in a home healthcare or a clinical setting. Whether using the classic or whether using the pro system, it's really quite simple. Lie down or lay back, sit down. You select an intensity or a program, push the start button, and relax. It really is that simple to use. The two complementary applications of BEMER are, one, the general improvement in circulatory parameters. So it has systemic effect, and this is accomplished with the full body applicator, the B body, and it should be the basis of every single application. On the second aspect, use of the special applicators according to one of the 10 intensity levels, or ideally the 3 programs, for superficial up to deep localized effects, and this is more of an adjunct to the general therapeutic effects of the B body. So as I said, the B body, according to the basic plan, which we will discuss here soon, is the foundation for every form of therapy, for the general improvement of the circulatory parameters as well as other therapeutic effects. The application depends on the individual. There are no programs or protocols for this disease, this condition. BEMER does not use any protocols for any specific disease, as BEMER is a Class 1 FDA registered device. So it's important to understand that the application depends on that unique aspect of the individual. Application should be twice a day plus the sleep program. And in cases of acute situations or acute injuries, more than a single application can be indicated, and usually is. This is the B body right here, and it's rolled up, but when we look at this unrolled, you can see here this young lady with the child. The BEMER has 4 coils, and 4 are located in the upper torso and 2 long ones in the lower area of the legs. And while these effects of the BEMER signal configuration, they've been scientifically proven and they're essentially pretty much independent of external influence, it's still important to follow some of the guidelines we're going to talk about here to really optimize your personal results. Looking at the special applicators, or the second application, these are designed to penetrate into local regions, and there's different applicators for this. The B spot, for example, is more of focused areas. It's smaller. The B pad is very versatile, long, flexible, and it covers larger areas. The B sit is also a comfortable seat. This is more of a focused region, but larger than the B spot. And of course, the B light is for superficial regions, and this is the phototherapy aspect of the BEMER. The B spot's a small applicator, and this connects to the B grip, and this can be used for smaller regions, smaller applications. You can either use it by strapping it on to a region, like you see this gentleman has the B spot strapped to his arm, or you can physically hold it in place, and this can assist in the delivery of the BEMER signal to the desired target tissue or area. The B pad is one of my favorite applicators, and its flexible multi-coil delivery system delivers the BEMER signal over a larger region. This woman here, you can see, is lying down, draping the B pad over her leg, and there's 3 coils that are in the B pad, evenly spaced apart, when it allows you to move the signal or the wave directed towards larger regions. Many times I recommend wrapping the B pad around someone's waist or orientating vertically up the spine to support the optimal blood flow over these larger regions. The B sits nice. It's a soft, comfortable cushion, has a single coil in the center, and the B sit, it's excellent for those people who sit a lot at a computer chair or someone who's ambulatory in a wheelchair. It's also great for portability when someone doesn't want to bring the full body when you're traveling. The B light is the only phototherapeutic applicator that the BEMER has available. It's an extremely bright light. It's a light-emitting diode, or an LED, and emits a pulsating monochromatic red light with a wavelength of 660 nanometers. And this makes the B light an ideal supporting application for helping with healthy skin, as well as supplementary aspect to cosmetic applications. I found the B-Light to be really helpful for many dermatological conditions that I see in my clinic over the years. And it's also great if someone's had post-surgical procedures and they're trying to help eliminate or diminish scars. You know, while the B-Light's been a superb clinical tool for me, many people use the B-Light for its cosmetic anti-aging effects to help tighten the skin, help support reducing wrinkles, dark spots, as well as strengthening the underlying collagen. And this can help give a youthful glow and really help enhance the suppleness of the skin. I want to talk a little bit about the sleep program. But before I do this, it's important to know what's happening in the circulation throughout sleep and wake cycles. We have diurnal variations in our sleep and wake cycles, and these are governed by circadian rhythms. Melatonin, cortisol, these shifts play a vital role in maintaining homeostasis and health. And it's one of the biggest issues for a lot of my patients is they don't sleep well. BEMER recognized this and created the sleep program to help support individuals who are seeking a more restful sleep. The regeneration process is mainly occurring when you sleep, and it's considered a very important aspect, especially for people in rehab, elderly, people very susceptible to infections. In fact, a lot of times being asleep is more important than the waking hours for people trying to support regeneration. The BEMER sleep program helps generally increase the effect of the daytime use or the active. It can help with the immune system. It can actually support the regenerative aspects or restorative processes of the body and help to clear out the excretion of waste products and acidic substance from the body. So the BEMER does have an outstanding spectrum of effects, and it really changes the characteristics of full body circulation. BEMER works to improve concentration, mental acuity, reduce the effects of stress, stimulates better blood flow through the entire body, and assists in the clearance and disposal of metabolic wastes. BEMER promotes relaxation. BEMER supports cardiac function, enhances physical fitness, endurance, strength, and energy. The nice thing about BEMER is it's effective for long periods of time. There's virtually no side effects and is very easy to use. The goal of the applications here is to activate as many blood vessels as possible, enhancing the systemic circulation and supporting cardiac function. And most blood vessels are located superficially, so the B-body is that primary cornerstone application that should be used and started with. The more severe the metabolic state of the user, the lower the level that should be applied. And the goal of each therapy is the improvement of metabolism. Therefore, begin at these lower levels and work up, increasing in intensity. I want to go over a few of these frequently asked questions. How can the nature of BEMER therapy be briefly explained? This is in the basic statements, and we talked about this. You know, BEMER is designed to improve the overall circulation by supporting the body's self-regulating mechanisms. The blood is the manner in which oxygen and nutrients and chemical messengers, as well as the immune cells, are transported throughout the body, and this is through the blood. And only when our cells, our tissues, our organs and fitness. Without proper blood flow, it's very simple. You cannot be healthy. Next question, it says, why is proper circulation so important for a person's well-being and physical performance? For me, it's quite simple. I mean, if you don't have raw materials being delivered to the tissues that are needed, that metabolically need this, then there are mechanisms that can compensate, but ultimately not for too long. We can go a long time without food. We can go a long time without water, but you cannot go a long time without oxygen. Your body needs oxygen. Your cells need oxygen, and it needs the capacity to be able to remove metabolic waste products so it can function in the most optimal way. Here's a question that I get probably the most often. Which diseases can BEMER cure diseases? BEMER is not a disease-specific application. And its effect on circulation and the resulting improvements that you get to the supply and removal of the substance throughout the body, this allows the cells to increase both the production of energy as well as the regulation of energy. And without energy, cells cannot carry out their tasks. So energy is very important, and fundamentally, mitochondrial bioenergetics, or ATP, is needed for all cellular processes. Therefore, energy is an important aspect. Many people forget BEMER is an acronym for Bioelectromagnetic Energy Regulation. Can I use BEMER with metal implants, or should I consult my doctor first? I put these two questions together because they're very related. BEMER can be used with anything that's in the body: sutures, surgical screws, titanium plates, mesh. It can also be used with people with electric or electronic implants, deep brain stimulators, insulin pumps, and other implantable devices, defibrillators. While BEMER cannot be the ones to say, yes, with your device you can use the BEMER, instead what you should do is you should contact the manufacturer, let them know that you're using a device with the highest output level, a maximum average flux density or intensity of 150 microtesla, and will this have any adverse effect on the implantable device that you're using? I can tell you this date, year to date, today, mid-October 2015, there's not a single device produced here in the United States that I'm aware of that has any counter effect with using the BEMER. Another question that I get often asked is, are there any side effects using the BEMER? Side effects are understood to be allergies, bleeding. To date, no dangerous side effects have been detected with long-term applications. However, and I want to go through this, I have had individuals say, I have had cramping, or my skin feels itchy, or I feel some myalgia, foggy thinking, more pain possibly. The cramping a lot of times comes from lack of minerals, magnesium, calcium, or other mineral deficiencies. And this is one of the reasons I absolutely have individuals using the BEMER have a glass of spring water, mineral water, both before and after, and ideally drinking this throughout the day. Same thing with the skin reactions. Generally, it's lack of water. Now, if someone is getting more pain or discomfort, this can also be, for instance, when I've worked with patients with nerve pain, I always say, okay, this is good. The body is responding to this. However, let's back it off. If someone's using level 5 or a program 2, then go to a program 1 or decrease the level. I'll say again, the power is not as important for supporting the self-regulating process, supporting the circulatory process in the body, as one might think. Even the lower levels have great results. However, if there are new symptoms that are occurring in connection with BEMER therapy, they should be diagnosed by a physician. Don't utilize the BEMER as something, oh, I've got this going on, this will help with everything. BEMER is a wonderful adjunct for both a clinical setting or a home healthcare setting. But any symptoms that are coming up really should be looked at and diagnosed by your primary care provider or a physician. How soon can results be expected? Everyone wants action now. This is nothing new. However, we have to look at the aspects of how long did these chronic ailments, conditions, diseases, the situation you're trying to work with, how long did it take to manifest? A week? 2 weeks? More like 1 year, 5 years, 10, 20, 30, 40, 50, 60 years of development. So you have to give the BEMER a chance to help support the body. However, generally what we found, individuals who are in moderate to good health have some level of effect in a 4 to 6 week window of using the BEMER on a daily basis. And of course, longer times for individuals with more chronic health concerns. Nothing changes. The BEMER is most effective when the basic plan is followed consistently and regularly. The other question I get is, how long does the BEMER effect last? These are 3 generations, but I really want you to pay attention to the lighter color, which extends all the way through time on the left, up to 12 hours. And the changes in characteristic are the intensity, up to 25-30% increase in the blood supply. Effects can last 8, 10, 12, 24, up to days, depending on your level of health. Someone who's in a more chronically ill situation needs to use the BEMER just like a medication, just like a supplement, and they need to dose this on a daily basis, twice a day ideally. The best way you can ensure that this BEMER therapy works for you is support your body on a daily basis. BEMER, again, is a lifestyle modification, a lifestyle choice. Making sure you're drinking plenty of water, staying hydrated, eating a balanced, nutritious diet, staying away from the things that you know can adversely affect you, and movement. Movement, movement, movement. You should do an average of 3 to 5 days a week, at least 30 minutes per day of movement or exercise. And if you're an individual who can't do that, you can even stand in one place and do exercise. But that commitment to movement externally is as important to the commitment that BEMER supplies internal exercise through its effect on the circulatory system. Another question I get is, can you overuse the BEMER? Can it hurt me? Can I harm myself? The BEMER is not going to hurt you. It supports the body's self-regulating mechanisms, which are innate, which are natural. However, it is important to follow the recommended guidelines, the basic plan and the user manual, following the appropriate levels. These intensity levels are based and used on desired depth of penetration, and they're not necessarily reflective, as it says here, of overall effective of BEMER therapy, which I've said over and over. We have to get this out of our mentality that more is better. Not the case here. In fact, for some people, more sensitive, these lower levels can be more effective than even the upper levels. Well, thank you for listening to today's webinar. My name is Dr. Joshua Burka. Thank you very much for your attention today.
I'm sorry that wasn't louder, because I hope you didn't miss out on a lot of that, because it really is good information. Oh, we need to. Well, my techie here will work on that. That's the contact information. For those of you who are not here in the room with us, go ahead and give me a call. My information is on the screen now. And what I can do then is direct you and find you a place to use the BEMER outside of the Spokane area. If you are...
Can't hear you.
Oh. Okay.
Thank you for that reminder. If you are in the room today and you choose to enjoy a free session on the BEMER, we have 3 of our BEMER beds set up for your use today. You also can call and get yourself, or if you'd rather come into the office, you can come in and get yourself a free session upstairs from the Parkinsons Center on 6th and Washington. So go ahead and take down this information. We'll also be giving out some cards. Okay, yes, I'm going to repeat the part about if you're calling in on the call today and you do not live in the Spokane area, and thank you for joining us, go ahead and call me, and I have a way of checking with the other independent BEMER distributors throughout the area, and we can probably find you a place to try the BEMER. All right? Okay, so at this point I want to tell you a couple of fun things that we're experiencing these days. The 2 exciting things. One of the most exciting is that we are just now starting our FDA approval. We are FDA registered, which means that our device is extremely safe. But BEMER and the founders of BEMER are always concerned about your safety and your health, and therefore they want to make sure that the FDA also approves our unit. So that's happening presently. We're excited about that. Another really cool thing is that BEMER has now signed a Space Act agreement with NASA. So within the next few years, the BEMER scientists and the NASA scientists will be working together to plan a physical undergarment that the astronauts will wear into space in a few years, from now on. so that their bone mass and their muscle mass does not disintegrate so quickly as it usually does when they leave the gravitational force of the earth. So that's really exciting. Now what I'd like to do is turn the microphone over to one of our associates. You met her a few minutes ago, Colette Bryden. I'd like you to hear what she has to say about her experience with BEMER.
Thank you, Gay. Well, as you all know, my name is Colette, and I'm honored to be here today among all of you because Parkinson's disease touched my life through a friendship with a very special lady. And I had the good fortune of sharing a few years with Sandy as we worked together to combat our illnesses. And they say it takes a special person to face the daily challenges of Parkinson's, and I couldn't agree more. Sandy's examples of perseverance, selflessness, and daily gratitude, no matter what was going on in her life, are still exemplary to me today. I try to emulate that. And here it is, Gratitude Month. And her and I always shared a lot of gratitude in the month of November. And I personally couldn't be more grateful for my introduction to the BEMER. And it was actually 2 years ago this month that I was introduced to the BEMER. So today I'm really excited to be able to share just a small portion of my journey with you on my highway to health and how I have regained so much of my health in such a very short time using the BEMER. Today I have exciting hopes. I have exciting hopes for my future, for today, tomorrow. I don't have to go through the remainder of my life with all the aches, the pains, the insecurities, and the illnesses that I was facing. I felt before my time. So people always want to know, what have you noticed about using a BEMER? Well, as you have heard today, BEMER enhances general blood flow. And I began feeling my feet again almost immediately. I had walked around on stumps for several years. And when I did have feeling in my feet, my nerves were on fire, along with sharp stabbing pains. I didn't know when these attacks were going to occur, sometimes when I was driving. And so I rarely have these attacks anymore, and I'm wearing all styles of shoes again, and I'm on my feet a lot during the day, and so I've test driven my feet, and they're pretty happy. In addition, due to my lifestyle and ignorance, I had destroyed the healthy flora in my intestines and developed an illness that left me totally wiped out on a daily basis. I had massive hair loss, all my joints ached, I often suffered from chronic pain throughout my whole body, I had terrible brain fog, and some days all I could do was just dress, bathe, eat a little food, and then I'd just sit in my chair in a stupor. Simple tasks like putting a bill with a check in a window envelope could sometimes take me up to 5 minutes. I would be shaking and trying to get that in that envelope straight. And I actually didn't even drive a car for 6 years. It was just too much for me. I couldn't handle that. So the first part of my body to start improving was my intestinal tract. And my stomach gurgled away every time I got on the BEMER. So I thought, well, something's happening here. And it was really fascinating to me because I was starting to feel better, but I was also feeling it, every time I laid down on the mat of the BEMER. My body seemed to be absorbing the nutrients in my food finally, and I was not losing weight all the time. And amazingly enough, in 5 months, my blood sugar dropped from 105 to 77. And that was with no change in diet. So other rewards that I've reaped are a full head of hair with new growth coming in all the time. That's one thing my hairdresser just can't believe. He says, you have new growth everywhere in your head. It's not just coming in little spots. And it was falling out to the tune of 1/4 to 1/2 of a cup every time I washed it. So, and one of the best things, of course, is endurance and energy. Isn't that what we all want? And it's often goes beyond what I feel it should be for my age. I'm working 15, 16 hours a day, 2 jobs, on my feet again, thinking again, all these wonderful things. My sleep, of course, is improved. And the other thing that's way, way, way down is my anxiety level. I have this overall sense of calm now. I think it's because so many areas in my body are awake again. and I'm functioning again. That the brain fog was horrible. So mental clarity is way, way high on my list too. I worked as an executive assistant for many years before the age of technology, and we had to retain it all in our heads. Well, that's coming back for me now. I can see my calendar appointments in my head. I can remember dates, telephone numbers, and most importantly to me, I can remember people. Not always your names, but it's getting so much better. And so I hope that you've heard something today in my short testimony that will encourage you to further explore and possibly try the BEMER firsthand here today. And I'd like to just share a quote with you from Maya Angelou. When you wish someone joy, you wish them peace, love, prosperity, happiness, and all good things. So today and always, I wish you all joy and good health. Thank you.
Thank you very much. Now we'll turn this over to Cindy for the question and answer period.
Thank you very much, Gay. Let's see, gonna put this down, I think, and work off of this one. Can you hear me all right? Okay. Just a quick note, I've had a couple of emails come through during the presentation. A reminder that we make a DVD copy of every one of these presentations. So not just today's, but any, except for maybe 2 months in the last 10 years, we have copies of these DVDs and the presentations on DVD. So if you had some trouble hearing all the information or seeing the information, please don't hesitate to contact me, and we'll get a copy of the DVD out to you. I got a new DVD copier that's actually, knock on wood, working pretty well, so it won't be weeks and weeks for you to get the actual copy. And I'll ask Gay if we can have permission to maybe get a copy of the slides if that's available, and if it's not, that's okay. But so if you had trouble today in viewing any of this or hearing any of this, call me for a DVD copy and I'll send it to you free of charge. So at this time, let's have all of our sites unmute their mics and let us know how many people are there with you today or were there with you. I know some people had to go. And if you have any questions. And you. Might have turned it off. And do you have a question about, or just?
Well, I understand the rules that we're supposed to be class to ask questions, but there must be other people in other stations that I haven't the faintest idea how this thing works.
Well, okay, so that was going to be one of my general questions too. So I wanted to open it up and was thinking, well.
Can't they tell us about how it works, and then maybe if other people have specific questions?
Okay, go ahead, Gay.
Yes, of course. What you saw, can you hear me here?
Barely.
It might not be on. I might have turned it off all the way.
And could you also please repeat the question for the video audience?
Yes, of course. The question was, there's a confusion about how the device actually works. In the video, what we saw was the wave, the sinusoidal wave. The BEMER is a patented sinusoidal wave, a frequency that enters the body and therefore stimulates the flow of blood in your body. So that is how it works. The sinusoidal wave is delivered by a pulsed electromagnetic wave, though this machine is not a PEMF. It is actually a very much more sophisticated wave than that. So what's happening is we are sending, the BEMER is sending 12,000 microteslas per second into your body to stimulate the blood flow. And once the blood flow is stimulated, then what you're going to have is much more oxygen, much more nutrients going into your capillary beds at that time and feeding your cells, over 1 trillion cells in your body. And in addition to that, then removing the waste products. So that's just in a nutshell how the BEMER works. Yes?
Is that the pad up there I put on my feet, for example? Is that what I do in practice?
Yes, yes.
I'm not an engineer, so tell me something.
So you're very interested in that. Okay.
Just want to know practically how I use it.
Yes, okay. Let's look.
So his question was?
The question was, what does it look like? Okay, well, in the video, we showed you all of the different pieces and parts of the BEMER. So what you're going to see here, if you come up...
He's got you on the screen now, too, where you can see it. They can see it in the outlying ones.
Okay, good. So what you're going to see is, first of all, we do have a full body mat that a person is going to lie down on. And this can be done, of course, in your lounge chair at home, or it could certainly be done on your bed, which is what I do. The full body mat is the systemic part of the BEMER, so that you are then, the wave is going into your body from head to toe. This is the full body mat. It's an 8-minute application twice a day. What that does is it makes sure that your blood is flowing, increasing by 30% from what it is now, 24/7. In addition to that, remember on the screen when we showed you the B spot? This is another applicator. This is what I used on my ears when I was working on my hearing. So that can be placed anywhere on your body and run on an 8-minute cycle as well. My favorite applicator is the B pad, which certainly can be used to wrap around your shoulders if you have pain in your shoulders, of course around your hips if you have pain in your hips like I do from osteoporosis, of course, or up your spine. This is how I work with my my increase in blood flow to my head every day.
And then I think he asked about his feet. So that would be the applicator that you would use that you could use on your feet to make sure that you are getting blood flow through your feet.
Go ahead and repeat that in there.
You can wrap this right around your feet or your ankles, and that will send the frequency right into that. I'll also say that 2 huge coils are located down here in the bottom of the BEMER mat. So when I'm lying on this mat, my calves and my ankles are right over these huge coils. BEMER put these big coils down in the bottom of the mat because that's the farthest point away from your heart. Does that help a little bit? Okay, and we can have you up here to look closer afterwards. Okay.
Okay, keep that because you may get another question, and then we can pass that on. Okay, so let's go to Anchorage, Alaska. Are you still there, Anchorage? And if I go too fast, just interrupt me as we go along if I missed you or if I go too fast. Billings, Montana.
We wanted to know how much the cost of this item is.
And does Medicare pay for any of this since it's FDA approved?
Is this Billings?
Yes.
Okay, thank you, Billings. One of the questions from Billings is the cost of the machine. As you saw again on the video, there are 2 actual machines that we sell for BEMER. What you're seeing here, what you will see here if you come closer to the equipment after the presentation, is the BEMER Pro. That machine is $5,990 plus tax. It comes with all of the applicators and the full body mat, which is everything you need to get the results that you want to be able to move that blood and actually send nutrients into your cells. What's nice about the Pro is you can run 2 applicators at one time. It's a big time saver, so that's important to me because I'm still working and I have a shop. But also important to people who don't want to spend maybe an hour on the BEMER a day. Maybe they'd like to spend half that time. This machine can also be programmed and it can be updated or upgraded free from the company anytime there are improvements that are made to the machine. The other machine is the BEMER Classic.
Questions about Medicare, though.
You keep going. It's okay. It's okay. Keep going.
Okay, I'm sorry. The BEMER Classic is $4,290. It does send the same wave into the body, so you're not getting, everything's good about that. The difference is you can only use 1 applicator at a time. You can't program it for special programs for you, and it cannot be upgraded by the company. Well, I think you could do that if you sent it to Liechtenstein, but that could be expensive. So there's some drawbacks to that machine, but it's a very good machine. Both of them are.
Yeah.
The Medicare? No. At this point, there is nothing in this country, even FDA approval, that is going to help a person buy this machine. The only thing that I know of that could help a person buy the machine is if they have a health savings account with their company. If you have that, sometimes that you can use that money for that, which makes it tax-free, I believe. Even after FDA approval, the insurance companies are probably not going to pay for sessions on this machine, and they certainly aren't. We don't think that they're going to pay for the machine, like reimburse us for the machine if we get them. Darn it. That would help. The question is, will the machine get less expensive in time? I'm sure it will not. There will be some machine. We are going to have a new machine coming out. That will be for hospitals here in the United States, for doctors. That machine will be probably 5 times to 10 times the price of this machine. Actually, this machine is actually priced right, because it is, if you think about having this machine and using it for the next 10 years, over time, I think it's $1.34 a day to use this machine, but you have to make that expenditure in the beginning. That's the hard part to get by.
Okay, if you want to buy one, can we talk a little bit about that? And people, that might be one of the questions across the board is...
I think so. I think it will be, right.
Because, you're not necessarily here talking about selling them. You're talking about the availability of them in your area.
Mm-hmm. Perfect. So, no, I'm not talking about selling machine today. That's not what I'm about, and I think you probably got that. What we do at Embrace a Healthier Way on 6th of Washington is we bring a person in for a free session. We educate them about the machine. We talk to them about what they might, what benefits they may receive. We never know for sure. They tell us about their situation, and then we make decisions about how to place them on this mat and begin helping them with some of the things they want to work on. So what we do is we actually sell a package. So we're going to sell a package of individual sessions, a package of, right now we're interested in selling 5 packs, which are $90 for 5 sessions, which, by the way, I will tell you, from what I know about BEMER prices for sessions across the country, our prices are very, very reasonable. This is a very extremely sophisticated machine and very effective. So if you do not live here and you're online, that's when you need to be able to call me, because I have no idea right now where the BEMER centers or the BEMER storefronts are in your location, but I will certainly try to help you find one.
And so then if someone doesn't own one, it talked a little bit in one slide about how long the results of going through a session lasts. So if you can't own one and go twice a day, use the BEMER twice a day, then if you were able to, let's say, go twice a week to somebody close to you in your area, do I remember right that it was about a 12-hour time period that you would feel the effects? And what does that 12 hours do long term?
It is always difficult when somebody wants to, to be able to actually work on some very specific places in their body, for instance, to help with circulation. We do see very often some very quick results with BEMER. Having said that, some people, as Dr. Burka shared up here on his presentation, some people do not have benefits even with a home unit, a home BEMER, twice a day. They don't have results for several months. But it's very exciting to see the pieces of having greater circulation. It may not, again, it's not disease specific. So how long will you get? I have no idea. The more you use it, the longer the effect lasts in your body. Looks like we're getting about 30% improvement with blood flow for 8 to 12 to 16 hours. That's what our scientists are telling us. That's pretty good. So we often have people that come in twice a week, and based on that, they're making their decision about whether or not they want to just come in for sessions, or they want to actually invest in a machine.
Okay, so
I have a hand for there, Laurel.
Okay.
Is there any benefits or warranties?
The warranty.
Go ahead and repeat that last part. We heard benefits and warranties, and did you have one other part of it?
That's all.
No, that's it.
Okay, thank you.
The benefits are individual, of course they are. The benefit is all of those items that we listed on the board, so blood flow, cardiac function improvement, waste disposal, nutrients into the body, less brain fog, more mental acuity, just and a tremendous, amazing sense of well-being, and that's very typical for the BEMER. Plus energy, plus that wonderful sleep program. For those of us who have a chronic illness, and as I do, it's very important to be able to use the sleep program at night. This program goes actually as you go to bed at night, you start the BEMER. It actually is used on a very, very, very low level for 2 hours. Then this machine shuts off all by itself, comes back on 2 minutes before you wake up, and gives you another 2 hours. That's what your body does at night when you sleep. If you sleep, it restores and rejuvenates you. So that's what the BEMER is trying to assist with. As far as the warranty, the BEMER warranty is, I think, extraordinary. It's a 3-year warranty on all of the pieces and all the parts except for the B light. Remember the light that you can use on your face or wounds or scarring, that kind of thing? That is that's a much more delicate machine, and so that's only warranted for like 6 months. Because if you dropped it, you certainly could break it. The others are a little more hardy. But 3 months for a full board warranty is huge.
3 years. Did you just said
3 years.
That's okay.
3 years, excuse me. 3 months wouldn't be very good, would it? That's not impressive at all.
Okay, let's move to Clarkston Tri-State Memorial.
Hello, we're here. We have 8 people. Have you had referrals from any of the Spokane doctors? And what does one session cost? And you mentioned the sleep program and the skin red light. That is included in the initial cost you mentioned? Okay, so now we're back to referrals and what does one session cost?
Okay. So referrals, yes. I actually work with naturopathic doctors here in Spokane that refer to me in the Spokane area. Yes, we have surgeons here. We have a surgeon here that I'm aware of that actually uses a BEMER for his clients in his office. We have all over the country. We have a lot of chiropractors and acupuncturists and massage therapists. A lot of alternative clinics. Oh yes, and then of course we have our Dr. Wiley here in Spokane, who is an absolutely wonderful optometrist who uses BEMERs with all of his patients in his office. So that's the referral piece. What does one session? One session costs $25. If you buy a package, obviously the price goes down. What else on that one?
The spotlight, all of that was included in
yes.
the 5990.
Oh yes, in the two prices that I mentioned, everything is included that you saw on the screen. The one thing that's not included in that is this wonderful B-sit. This B-sit it's pricey, and it's well worth the money. This is the only item that is not included in the prices that I quoted to you. This is used for wheelchairs and travel in cars, travel on airplanes. We use it a lot for people who sore feet, and they can put it right on the floor in front of their chair, and they can put their feet on it, and it's a wonderful application for that. I don't know if there were any other pieces to that question.
Was it answered? Yeah. Any neurologists in Spokane use this?
Neurologists specifically, not that I'm aware of. This gentleman back here has been very patient, waiting to ask his question. Would you like to go ahead? Now, that's a great question. His question is, are there any studies being done by the medical establishment? Actually, the answer to that is absolutely. One of the situations we have right now is that we are seeking FDA approval. So we have volumes of scientific studies that have been done on our machine for 17 years. Generally speaking, done in Europe, which is where the machine was created and used originally. The FDA is asking that we not reference those at this time because we can do that after the approval, but right now they're asking us not to, and that's perfectly fine with us. You can go online to something called pubmed.gov. I'll spell that. PUDMED.gov, G-O-V. PubMed is an online national site for studies. If you go on there and you type in BEMER, you will be finding some of the studies that Dr. Rainier Klopp, K-L-O-P-P, has done on our machine. That's very interesting. What's that?
He said he sounds like a German.
He is. Actually, Dr. Klopp is the director of the Institute of Microcirculation in Berlin, Germany.
Yeah. And what about Coeur d'Alene? Are you still there, Coeur d'Alene? How many people
We had 3 people here, and my question is, what kind of results have you seen with Parkinson's with this? Because I haven't heard anything about that. A lot of other diseases, but what about Parkinson's disease?
Okay, so this question is, what am I seeing? What are we seeing as improvements with Parkinson's? Well, we actually work with a lot of, I have had several people that have come to me and come to my associates that actually live with Parkinson's every day. You already know that the FDA is not going to let me tell you what we're seeing for Parkinson's. They have asked us not to give testimonials of a third party. I can tell you about my effects, and Colette and Dave can tell you about their effects. That is fine with the FDA. What is not okay is that I tell you that on Thursday I had a person with Parkinson's come in and they are telling me this. I have seen the studies and I have seen the notes on the email from people that I work with and this. So what I can tell you is, well, no, I'm going to ask you. Yeah, I'll do it that way. I'm going to ask you, if you think about your struggles with Parkinson's or your difficulty in living with Parkinson's, do you feel like greater circulation throughout your body, more nutrients into your cells, more oxygen into your cells, and of course, the waste removal would be good for those issues that you're dealing with? If you can answer yes, then you have your answer. And that's all I can tell you today. Go ahead.
Are there studies that indicate that BEMER really does increase your blood flow?
You mean, oh yes, yes. In fact, I was just talking to you about Dr. Klopp.
Repeat the question, though.
Oh,
for
I'm
us.
sorry.
That's all right.
Is there any way to measure what happens inside the body, or instead of just saying, we think that happens? Yes, there is. Dr. Klopp, a scientist, he actually uses a machine called an intravital microscopy. No, that's not quite right. Intravital microscope. Well, anyway, it's a microscope. Say it. Microscopy. He uses that device there in Germany with his patients, and what it is a non-invasive. It's a little pointed object that actually will penetrate the skin, not breaking the skin, but it will measure the blood flow. It will see it, and Dr. Klopp can see it on his screens when he's doing this. So yes, he in other words, does he know that it's increasing, that the BEMER use is increasing the blood flow by 30%? And do they know that it's lasting 12 hours to 16? Absolutely. We can see that. I can't, but he can.
And there are pictures of the differences. There are pictures of the differences.
Yes, there
it's
are.
amazing.
Mm-hmm.
Okay. There's our locations out of the other sites. Let's go around to them pretty quick because some of them actually lose their room. So let's see. They might have already left, so we'll go through this pretty quick. But Colfax, are you still there? Colville, Providence, Mount Carmel. And I think it looked like Miles City was. They were gone. Moses Lake, are you still there?
No, this is Miles City. We're here.
Oh, okay. I saw a picture and there was no people in it. I apologize.
Oh yeah, we're here.
How many people?
Anyway.
And how many people?
We had 11 people. We had 11 people. And did I understand you to say that this machine would not affect the deep brain stimulators?
Yes, the question was, did this gentleman understand that there is no problem with the deep brain stimulators, the use of that. Yes, that's what Dr. Burka did say. So if you have implants, if you have metal in your body, a new hip, whatever, that's not a problem for BEMER. And the reason for that is the frequency on the BEMER is so minute, the microtesla's, and those machines actually allow some very high stimulations safely, like being around microwaves, that kind of thing. Okay, ours is so low, so it is safe.
Did you have another
Okay,
question?
and what about also within like the state of Montana, the availability of getting into a program to use one of these for some time to see what effect it would have?
Well, again, I'm going to have you contact me to see if I can find people in Montana that have a storefront or that will let you use their own private machine. We do have several people in Montana who are distributors like I am, so it's very possible.
Well, thank you very much.
Thank you.
Moses Lake. Oh, by the way, thank you, Miles City. I apologize. I just didn't see you in the picture. That was my fault. Moses Lake.
There are 6 of us here today, and I do have a question for you.
Go ahead.
What is the return policy?
What is the return policy?
The return policy on a BEMER is 30 days. There is a 10% restocking fee if you return the unit, but there is a return policy. That's pretty typical, I think. 30 days.
Oh, go ahead. Yep.
Can I get information on the internet on the BEMER besides your reports?
Can this gentleman get information online on the BEMER? Yes. The cards that we give you, the business cards that we hand out today, you can get information on the you can go to any of our sites with our business cards. You can go to any of our sites, and then you can go on to our portals where you can see some information about the BEMER.
And I'll get Gay's business card so that if you contact me, I can get that to you.
Right. Yep.
Do we have any other questions? Thank you.
Thank you for those. Pendleton. Port Townsend Jefferson Healthcare. They're gone. Okay, thank you. Pullman Regional Hospital.
There are 10 of us here today, and we have a question.
Thank you. We're ready when you are. Oh, go ahead and we can't hear your question, so push down the mic button again.
Okay. How does this product, the BEMER, compare to a similar product called Earthing?
What is the name of the product, please? Earthing? Okay, yes, I have. How does the BEMER compare to Earthing?
Yes.
The products that are associated with Earthing. I have experienced Earthing myself, and I think it's very good. Earthing is actually, if I'm understanding the question and the process, Earthing is when you're actually using the frequencies that naturally come off of the Earth's surface, which are, depending on where you live, from about 30 to 50 microtesla's. Our machine is actually placing that wave, sending that wave into your body, whereas the Earthing is very, I guess you would call that very, 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 very subtle. It's not an interactive process like the BEMER wave is.
It's like the BEMER, you can wrap the one pad around your feet or
well,
your
then we're
elbow
actually
and different
sending
things.
we're actually sending a wave into your body rather than having you lie on a sheet that can interact with your body. It's much different.
That's a good question, though.
It's a very good question.
Did you have any other questions, Pullman? Uh-oh, it pushed the button again.
There were no other questions. Thank you.
Thank you very much for being there, everybody. Richland.
My hometown.
And they might have already... There's a couple people. Hi, Richland. Sometimes they have a problem with their audio, maybe.
Can you hear?
There, now we can hear you. Yes. How many do you have?
2. And I do have a couple of questions.
Okay. We're having a little bit of trouble with your audio.
Let me go up to the...
Thank you so much.
Is this better? Is
Okay.
this better?
There we go.
Yes, I have 2 questions. One, I'm a little concerned about, is there added stress on the kidneys because you're filtering more things out of the blood? Is there more stress on the kidneys? And also, does this interfere with using a CPAP or a BiPAP machine?
Okay, the first question from Richland is, does this machine interfere with the kidneys? Put too much stress on the kidneys. What the BEMER is about is always eliminating the problems with organs in the body. So it's restorative. So is the wave strong enough to put stress on an organ in the body? No. As long as you use this appropriately. And that's my job. That's the job of the associates here. If we place you on a BEMER, we're going to be talking to you about your situation so that we are very gentle with your body. So that's the answer to the first question.
Hold on. I think another part of that question, though, is as you're removing so much waste from the body, is that putting extra stress on your kidneys by the waste that's going out of your body?
Because the kidneys are a major waste disposal site, yes. We would use very, 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 very low levels to begin with you. And that would be appropriate, and that would be okay for your body.
And then after...
The other question is the CPAP machine, the one for the breathing at night. Absolutely, we use it in conjunction with them all the time. Even if you're using oxygen at night or whenever, we can use the oxygen mask, CPAP mask, at the very same time that we're using the BEMER, at the very same moment. Perfectly safe.
Okay. Did you have any other questions, Richland?
Not at this time, but thank you.
Thank you for being there
Richland.
today. Sandpoint, are you still there? Thank you for joining us today if you are. Sandpoint hasn't logged on. There they are. They might not know that we're looking at them, though. But Sandpoint is one of our sites that hasn't logged on for a really long time, and we're really excited to have them back today. It looks like they can't hear us. And back to Spokane.
We have a gentleman here who has had a question.
And then there's another question, too.
Do you have a question, sir?
Yes, you mentioned the Dr. Klopp's website and studies. I assume those are all European studies. And therefore,
Probably.
some of those studies the BEMER on patients diagnosed with Parkinson's.
Not necessarily. Not necessarily. I don't know that. I really don't know that. And it's not it's important to know it's not Dr. Klopp's website. It is a national website that has thousands of studies of all kinds of diseases, all kinds of techniques for solving the problems with these disorders. And so I don't know what you'll find on there. I've seen a lot, and it's very good information. But again, you know, I know it's frustrating because I even ask those who are in the know about BEMER, like our founders of BEMER. I even ask them myself, well, what about my, you know, something I've got going on with me? And they remind me, Gay, BEMER is not disease specific. So if you feel that circulation, improving your circulation, is something that you need, is something that would help any part of your body, greater nutrition, greater waste disposal, greater oxygen, therefore greater energy for the performance, the optimal performance of the cell, if you feel like that would be a reasonable improvement in your body, then I would say yes. Any situation, we really do want you to understand, as I did with my own results, if your body is able to work better, easier, more fluidly, then your body will have results. Your body will begin to work on itself.
Let's do the one last question over, and then they'll be here with the actual BEMERs that you can ask.
Is there another question in here? Oh, I'm sorry. But the question is effects on, you know, neurodegenerative processes, right? Yes. Yes, of course. Again, really the same answer. One of the things, you know, the BEMER is going to help you to have more blood circulation from here to there. So if it's something going on in your brain with whatever is going on in your life, then the BEMER is going to help get the blood up there. If you've got something going on with your feet, the BEMER is going to help you get blood circulation. Once the circulation is there, then the body receives what it needs to perform its natural functions. So I can't talk about diseases, but is, you know, neurogenesis, of course, degenerative. I mean, neurodegenerative. You know, yeah. It is the body's ability to begin to make a difference within itself.
Well, that's
our last question, but we'll stick around.
Yep, Gay will be here along with the other
We'll
BEMER.
all be here to talk to you individually.
Yep, and we're still here for another half hour, but the other locations, if you thought of a new question, or if the contact information for Gay is up on the screen, but if you thought of another question, email Cindy, me, at center@SpokaneParkinsons.org. And I'll get the questions to Gay, and she can pass them on to the other BEMER representatives here today. Make sure, don't hesitate in sending them to me. I'll get them to them. We'll get you an answer. But I really appreciate everybody sticking around for the presentation and the question and answer part, because we went a little long. Thank you, everybody who did that. We really appreciate you. Thank you, Gay, and everybody here who's part of this group to give us information on the BEMER. And everybody who's attending, thank you very much, and happy Thanksgiving. We will see you the second Monday of December, where we have acupuncture. We have an acupuncturist talking about what it is, how it works, and the benefits. So we'll see you here the second Monday of December at 2 o'clock. Thank you so much.
Thank you very much. This was wonderful talking to you. Bless you all.